So we will move on to our next presenters, who are Jessica Farber and Rachel Goodell-Munro, who are presenting CommunityFirst Solutions for COVID-19. Jessica is the Community Readiness Coordinator at SeeChange Initiative, a Canadian non-profit organisation dedicated to supporting vulnerabilised communities to create their own solutions to health crises. She works with community leaders to organise and prepare and respond to COVID-19 using the CommunityFirst COVID-19 roadmap. Jessica also founded and serves as an advisory board member of an initiative to welcome newly arrived asylum seekers to Montreal. And prior to SeeChange, Jessica was a program manager at the Samuel Centre for Social Connectedness, where she directed research, outreach, and advocacy related to forced migration on the North American continent. Jessica holds a BA in International Development from McGill University. Her co-presenter, Rachel Goodell-Munro, is a lawyer and an activist specialising in humanitarian assistance, global health, governance, and bioethics. In 2018, Rachel founded SeeChange Initiatives and now serves as its executive director. In 2007, Rachel became the founding president of Universities Allied for Essential Medicines, and she recently served as a director on Médecins Sans Frontières International Board. In 2013, Rachel was invited to be a professor of practice at McGill University, where she lectures on international development, humanitarian action, and access to medicines. A further thank you for both our presenters is that it is only 5 a.m, or possibly slightly later now in Canada. So our thanks for getting up so early and looking so bright-eyed and bushy-tailed despite the early hour. And I'm really delighted that you're joining us and for being here. So thank you very much, and over to you.
Thanks very much, Kai. No, it's a pleasure to be here. We've been looking forward to it, so we were quite willing to get up early this morning to join you. So my name is Rachel Goodell-Munro, and as Kai said, I'm the Executive Director of SeeChange.
And my name is Jessica Farber, and I'm the Community Readiness Coordinator at SeeChange.
So we're here to talk to you about community-first solutions to health crisis. You know, throughout this whole conference, we're talking a lot about decolonised approaches to health crises. And the COVID-19 pandemic has clearly shown that communities, and especially the most vulnerable communities, are on the front lines of the pandemic response. And as the UN says, this means that we need to invest in them. So what we're trying to do at SeeChange is work with communities to understand exactly what does that investment look like in practice, and how do we ensure that those investments are truly decolonised. But I'm just going to back up for a moment and just tell you a little bit about where SeeChange comes from. So my background, as Kai said, is as a humanitarian. I worked for 3 decades with Médecins Sans Frontières, and I worked from a field level right up to a very high level policy. And what I saw in all those years of work with communities in crisis situations was more and more those communities were unable to express their own needs and have their own voice really at the centre of the response. As the humanitarian apparatus grew and expanded in those 30 years, the domination of the system increased more and more, and it became more and more difficult, I found, for communities to be at the meeting table. And I think, as was shown by a previous speaker, their voices were really not heard even when those meeting tables were created. So with SeeChange, we wanted to try to see how we could work with these communities to be able to raise up their voice and take their rightful place. It started in the north of Canada, actually, in the Canadian Arctic. We started working with Indigenous peoples who were suffering, who have been suffering for decades from a tuberculosis epidemic. So this airborne disease with a very similar transmission as COVID-19 has been plaguing these communities ever since white people appeared in the Canadian Arctic. And I couldn't believe that here in Canada, a country so rich with such an incredible health system, would have still a problem with tuberculosis and where people are still dying from it. So I decided to work on that, and we created with the community what we call CommunityFirst Solutions, where the community is really guiding their own response to tuberculosis. And then enter COVID-19 in March of last year in Canada, and we began to pivot towards COVID-19 at the request of the community. And what we did with the community for COVID-19 and for tuberculosis has become our Community First Solutions. And this COVID-19 initiative in particular is what we see as a really practical example of a truly decolonised approach to health crisis response. And that's the story we're here to talk about today. COVID-19 has shown how many vulnerabilized communities are completely abandoned by governments and institutions during this pandemic. But this is nothing new for many of these communities. This is their story. I often talk about COVID-19 being the ultimate disruptor. But on the other hand, it has also revealed many new ways of working in humanitarian crisis. And it's revealed those new ways quite simply because the old ways don't work. So on this image, you see that we've tried to create this continuum of working with a community where we connect with them to try to understand more their situation. We engage with them very directly to see how they have, what their history is, what their history of trauma is, and how they want to move forward. And then we work with them to try to leverage the skills, the assets, and the resources they have in community to co-create responses. And this is all in a continuum of having a continuous feedback loop where we can reflect to really appreciate what we're doing. So now I'm going to hand over to Jess, who's really going to explain in more detail how we've been doing this Community First COVID-19 response on the ground. Thanks, Jess.
Thanks, Rachel. So as Rachel mentioned, this initiative that we're talking about today emerged in Clyde River, Nunavut back last year. So in March 2020, when the COVID-19 pandemic first became a reality in North America, the community came to us and asked for support. They had received a plan from their territorial government to respond to COVID, but they felt that it was very standardized. It was extremely long and complex, and they really felt that it did not meet the reality of their 1,200 person, very isolated community. So we worked with them to create an emergency planning framework that they could use to translate to Inuktitut and create a plan that did meet their realities, that was culturally appropriate, that allowed them to identify the unique vulnerabilities in their community and also leverage their own assets. But ever since then, we've been also sharing this experience with other communities, other vulnerabilized communities around the world, in Latin America and East Africa and beyond. As in the case of Clyde River, many of the communities that we've been working with, they've been made vulnerable by colonialism and other historical and current neglect. Some of these communities, as with Clyde River, have received inadequate support from government that's not culturally appropriate, or they've been completely abandoned by their governments and have received no support whatsoever. So the Community First Solutions for COVID-19 initiative that we're talking about consists today of 3 integrated components. We have a roadmap, which is a digital planning guide with resources. We created an accompaniment program through which we provide one-on-one support to the community leaders who are using this roadmap. And we also created a solidarity network with these activators. I'm going to speak briefly about each one. This is basically what the roadmap looks like. It's broken up into 3 sections: organize, prepare, respond. We also added a sustain step with several steps in each one. And we soon created that we launched it into a website. We translated this roadmap in 5 other languages, including Inuktitut, which is the local language of the Inuit in Nunavut, as well as Spanish, French, Portuguese, and now Swahili. And we launched a website to host this plan. First, a simple Squarespace website, but we soon created a more robust platform. And on this website, community leaders can go through the plan step by step, and as well view different resources under each step. And we also created a database of resources as well. And the idea with these resources is that they're very much community facing. They're all verified in line with WHO PAHO guidelines, but mainly using infographics, examples from other communities, case studies, guides, templates, and things like that, not too much complex jargon that we're used to seeing. So with this roadmap website, we've seen a lot of demand from communities around the world. It's been accessed in over 100 countries around the world, but this project is also about much more than just a website. As we began reaching out to community organizations and networks in Latin America and now East Africa, we created an accompaniment program as well, through which we provided direct support and also solidarity to the community leaders who were adapting and implementing this plan in their communities. Today, we're working closely with 11 communities in 7 countries. Here's one example from a community that we've worked with in Retoca, Honduras. It's an indigenous Lenca community who really received zero support from their government to respond to COVID-19. They're completely on their own. So we partnered with a local Honduran environmental organization and then worked closely with this group here, which is the Organized Women of Retoca, as well as the Indigenous Lenca Council. And they use this roadmap to create an adapted plan for their community. And what they found and what they told us was that they really also use this roadmap as a tool for empowerment, especially for these women, which often many of them didn't have a large decision-making platform in the community, but they, having this tool and having the support from us, gave them a lot of confidence to continue to take the steps to respond to COVID, even despite any lack of support from their government. Here are a couple of other communities that we've worked with, including one group in Tana River, Kenya. We also worked with a young nursing student in Chiapas, Mexico. There's another photo from Honduras, and a women's group in Guatemala. And similarly, what these individuals also shared is that they really felt decreased levels of anxiety by having a plan that they could adapt and fit to the needs of their communities. They also felt empowered by using this. And they felt more capable and equipped to share correct messages around COVID-19 with their community members, and also to identify what they needed from external actors, rather than the humanitarian external actors just telling these communities what they needed. And then the third component of the initiative, as I mentioned, is a solidarity network. So we found that many of these community leaders we were working with felt very isolated in their responses. They wanted to connect with others in their region, around the world, who were potentially experiencing similar challenges. And so we created the solidarity network with a Facebook group, a WhatsApp group, and we started to hold monthly meetings where these leaders could form connections, discuss ideas, discuss common challenges. We now do workshops on self-care and mental health. And I just want to share here a few words from one of our activators who's a nursing student in Chiapas, Mexico.
Yeah, we can't hear it, Jess.
Oh. No?
No,
It's not working? Okay.
No.
Okay, gonna skip it.
Maybe just to say what Michaela was saying was how using the tool in her community had given her really that sense of empowerment and had been really a tool for the community to work.
Great, thank you, Rachel. So 1 year later, we are seeing that this roadmap continues to be relevant to the communities that we're working with. Many of these communities have still received no support from government, and we continue to reach out to new communities where they're saying that People are still not even believing that COVID-19 is even a reality because correct information has not reached these isolated communities in their own languages. But we're also seeing a new problem now with vaccines. So while vaccines may not reach many of these communities for several years, we still have to ensure that they have accurate and culturally relevant information about vaccines ahead of time, especially for those communities who might have experienced historical trauma around vaccines or other medical treatment. So we're now working with communities to create comics to talk about vaccines. Together with our community partners, we're planning to edit this comic in local languages and also to insert the most prevalent myths and rumors in their communities and use this comic as a way to counter those myths. So as we speak with the communities we're working with, we see that COVID-19 is just one of many intersecting and compounding crises that communities are facing. The health, social, and environmental crises that communities were already experiencing before the pandemic are only being exacerbated by COVID-19. This past fall, when 2 back-to-back hurricanes struck in Honduras, we saw that the communities we worked with quickly adapted the COVID-19 roadmap to create a roadmap for dignified shelters that would house people who were displaced by the storms in a way that would also be safe for COVID as well. And just to say that we are continuing to work with communities, not only to strengthen and adapt their COVID-19 plans, but to accompany them as they respond to their own health crises in their way. I'm going to hand it back to Rachel now to conclude.
Yeah, thanks, Jess. So the conclusion of all of this is that we really need to help uplift solutions that are created within and by communities. It's not just about bringing in external solutions, but from the outside, but it really needs to be that we work together in complementary ways. And as this quote shows, a lot of those solutions are present inside the communities. But if they have those solutions, but they don't have any of the resources, how can they use them? And it's not only financial resources, that's the first kind of resources we immediately think of, but communities have identified that they need good information, they need tools to be able to respond, they need the training on certain issues. And a very big part of what we found is that they need that solidarity, that sense of confidence, that sense of can-do, that sense of their community values being respected and honoured. So working in a radical community-first way requires that us as humanitarian actors and communities as humanitarian actors form different kinds of partnerships. We need to think about how do we shift the balance of power. We've talked about power a lot in this conference, but how do we really shift that balance of power, not only through the shifting of where the money is going and how we finance the system in a decolonised way, but also about knowledge and know-how and expertise in responding to those crises. It's also about practicing a trauma-informed and contextualized approach. Many of these very vulnerabilized communities have a history of colonial damage and are still living through that kind of discrimination and racism in the world today. So we need to meet communities where they're at and understand their context in order to be able together to develop solutions that are appropriate for those communities. And all communities are different. They have different needs, different requirements. There is no one size fits all approach. And lastly, we need to really support communities to leverage their own assets, because there are very strong assets inside communities. And once they've identified those assets, they can really see what kind of external support that they may need. We all know that colonized approaches mean a top-down approach with a centralized decision-making that's based in a Western framework of thinking, and usually in a place that is not the community. So a truly decolonized approach means that humanitarian actors really need to engage in a deep listening with communities. Deep listening means listening beyond the words and understanding communities in their cultural context and ensuring they are the ones that are at the center driving their solutions. It's great that today a lot of us, many external humanitarian actors, are talking more about community-led, community-driven, community-centered. We talk about delocalization, and this is fantastic, and we need more people and organizations to drive that forward. But what we've seen from our work with these vulnerabilized communities is that we need to go even further and ensure that these terms don't just become buzzwords with no depth. Because what we've seen is that each term is not enough on its own. It's not actually radical enough. The crises of the 21st century are so deep and so structural that we need a massive paradigm shift, not to simply a tweaking around the edges. And so what we need is an approach that encompasses all of those community-led, centered, driven, and take them all together, because each one approaches it from a different angle. And if we can combine them, along with a renewed commitment from all humanitarian actors to listen, to engage, to hold space for, and to learn from communities, and to meet them where we're at, then we can really have a response that is decolonized. And that is what we're calling Community First. Thank you very much.